My name is Kristin Kress. I grew up in West Bend, Wisconsin. I went to the Medical College of Wisconsin in Milwaukee, Wisconsin for medical school. And then I went to residency in orthopedic surgery in Burlington, Vermont. And now I'm here doing my foot and ankle fellowship at OrthoArizona. When I narrowed it down to wanting to do foot and ankle fellowships, I was looking at all of the different programs that were available across the country. And this one stood out to me because it was private, and being an academic institution, obviously coming from a residency, I was interested in learning more about the other side of academics, being private practice. So I think foot and ankle is the most diverse thing in orthopedic surgery. It has the most diverse cases. I feel like if you do joints, you do hip and knee replacements. I know that's a gross understatement, but we get to operate not only on the foot, but on the ankle, and we all go all the way up, close to the knee. But the breadth of cases that you do in foot and ankle is so diverse that it's not the same thing every day. You can do 10 cases in a day here, and you're doing 10 different things. And so your brain is constantly going, and they're hard patients sometimes, they're hard problems, and it's not just straightforward. And I think that's what drew me to foot and ankle originally. I would say this was by far the best year of my training. I loved being in Vermont, and I loved the University of Vermont. But here, I feel like I had the most fun, and it was the most beneficial learning experience for me. These guys work so hard, and they've taught me so much. It has really, truly been a fun year. You will learn a lot about private practice, life, and foot and ankle. And my family and I have really enjoyed our time, and we're going to miss them dearly. And the conferences that we have and the banter that goes back and forth. And I truly consider them my friends, and I will definitely be staying in touch with them. I think people should choose to come here. It's a whole different experience than a residency experience. And it has been a great year. And I wish everybody, that is applying and thinking about foot and ankle fellowship to really consider OrthoArizona. These guys work really hard, and you will learn a lot, and you will become a great foot and ankle surgeon at the end of this.
Hi, I'm Dr. Jason Lake with OrthoArizona Foot and Ankle Institute, and I just want to take just a moment to talk about our first fellow, Dr. Kristin Kress, and kind of what it meant for me in our practice. Having our first fellow was wonderful. I got much more out of it than I thought. And I guess my favorite part was probably the relationship part of it. I think that we're going to have someone who we're in contact with for the rest of our careers. Being a newer fellowship, we don't have a ton of fellows, so it's really going to be easy for us to keep in touch and continue to help her even when she goes out and gets her job over the next few years. And I'm really excited to be able to be part of that.
So here at OrthoArizona, because all three guys have a little bit of a different niche, I would say, we see a breadth of cases. And so there are so many different cases. If we do 10 cases in a day, most of them are different than the one that we just did. And so it ranges from little dorsal chylectomies to ankle replacements, or fusing the tibio-talar joint, and doing big Charcot reconstructions with frames with Dr. Jaffe up in Scottsdale. So every day is different, and the cases range from things that take 10 minutes to things that take 3 or 4 hours. And so that's being so diverse here has been really helpful and beneficial, and I've learned a lot. And I don't feel like there's anything here that I wish I would have seen more of. It's hard to teach somebody when the right procedure is right for that person, and what procedure is right for that person. And that's where clinic is super important. And I think that's where I learned the majority of what I've learned here. Because there's 3 different people that I've been working with, Dr. Lake, Dr. Patterson, and Dr. Jaffe, I've gotten to get into the minds of 3 different brilliant teachers. And so each of their perspective is very different. And so I've learned how to approach, the athlete, the diabetic patient, the trauma patient, because each one of these guys kind of has a little niche in that area. And so it's been really helpful to take what Dr. Lake does with his athletes and his sports patients and kind of translate that sometimes into diabetic patients, where Dr. Jaffe takes care more of the diabetic population. And then Dr. Patterson has a ton of trauma patients. And so it's been really interesting to kind of meld the 3 minds into one, which is really me, I guess, as their fellow.
We're just finishing up our first year with Dr. Kristin Kress. And I'll tell you, it's been truly amazing. It's been better than I could have imagined, being able to teach and be taught. Learn when you have a fellow, it certainly makes you put on your A game, and just having that collaboration with a fellow, certainly different than being a student and a resident. She was a valued member of our team. So, I hope she has a great career. I think we did our best, training her, giving her the pearls that she needs. We all have a very high interest in teaching and looking out for the success of all the fellows that we have and will have in the future. So, I wish Dr. Kress nothing but the best, and looking forward to the next fellow and the next adventure that we have.
I have a great appreciation for what it is, and these guys work very hard, and it's good to see the other side. Academics is very educational and research oriented. Coming from residency, you have to do an academic project and be very involved in research. And a lot of your time during residency is spent doing that stuff. And in private practice, we do tons of cases here, way more cases than I've ever done. I feel like I've done more cases in fellowship in 1 year than I did in 5 years in residency. We work hard here, but these guys, they are good teachers too. And so you get a lot of very practical experience. And the business side of it was really important for me to see too. In academics, you just do what you do without thinking about who's paying for it or what the cost of the patient is. But here you have to think about all that stuff. And so I feel like I have a whole breadth of understanding about medicine in general, and I can take that with me next year when I'm a hospital employee. Next year, I am hired by Aurora, which is a big healthcare company in Wisconsin and in the Midwest. And so I'm going back near my family. Obviously, I don't know if you can see, but I'm pregnant. I'm pregnant now. I'm about to have a baby any day now. And I have a little guy at home already who's 19 months old. I learned that private practice was not for me, but I've learned a lot, and I'm very excited to take what I've learned into my hospital employed position. OrthoArizona has been a great year for me, a great year for my family, and I've learned a lot. It's a great fellowship program, and I think one thing I would say is some people may be timid to apply to this program because it is relatively new. I'm their first fellow. I have had no time during this year where I felt like I was underappreciated or not being utilized, or that it could be different or better. I was taken under their wing right away, and I learned a lot. And so even though they've only had one fellow, they know what they're doing here. And so this is an awesome program to be a part of.